from KQED.
Good morning. This is the California Report. I'm Madi Bolanos in San Francisco, and these are the California stories we're following. Finding community in California. As we age, our social networks tend to shrink, leaving us feeling disconnected from the world around us. And that can take a toll on someone's mental health. But recent studies have shown this feeling of loneliness is also linked to an increased risk for heart disease, dementia, and early death in older adults. That's why a coalition here in California is working to change the way we address aging by bridging the gap between health and social care.
Glad you don't have a camera for this.
I know.
It's a monumental day for 83-year-old Shorey Chapman, who's getting a professional haircut for the first time in a long time.
My neighbor cut it, but he didn't know what he was doing.
I know. See.
In the last couple of years, Shorey hasn't ventured out of his small apartment complex in San Francisco much. He broke both his hips in the last decade, so getting around is difficult. And he doesn't have his wife Margaret around to help. She went through multiple surgeries in the last year and is living in a care facility in Santa Rosa.
I call her every day at 10 o'clock, 10 in the morning, and we talk for half an hour. So that works out pretty well. We have a wonderful relationship even at a distance.
Even so, Shorey recognized he needed help with small tasks like taking his clothes to the laundromat or throwing out the trash. And, well...
Because I'm kind of lonely, to tell you the truth, although I do have more company than I used to.
Through the help of a pro bono social worker, Shorey found San Francisco Village, a nonprofit that connects volunteers with residents 65 years and older in need of assistance. That's how Shorey met Lisa and David Rice.
They are the greatest thing since sliced bread.
They walked Shorey to his haircut today. They spent Thanksgiving together, and they've even driven Margaret down from Santa Rosa to spend time together. For David and Lisa, who just moved to the city from Texas, this is also more than a volunteer gig.
It's been really enriching and given us a sense of connection, and almost like a sense of family.
These are deep emotional needs that all of us as human beings have.
That's Kate Hopke, the executive director of San Francisco Village. She says as we age, there are many things we need to do in order to stay healthy that are not addressed by our current healthcare system.
Getting a ride to a medical appointment, having fresh food in the house, being able to transition to home after a hospitalization, fighting off isolation and loneliness.
That's where the Village model comes in, and it's expanding to other parts of the state, including Kern County. The goal is to create a network of communities for seniors who can't afford to move into a senior living facility and don't qualify for low-income assistance programs. They're called the Forgotten Middle. Kristen Hayashi has studied this group with the National Opinion Research Center at the University of Chicago. She says these programs are great, but
really is illustrative of a patchwork of systems that older adults are navigating, but we want to make sure that there's equitable access to these services.
She says we need policy solutions that provide long-term housing and care options for middle-income aging adults.
Well, hello there.
Back on Shorey's block, Shorey introduces Lisa and David to his daughter, Disa, who's visiting from the East Coast.
Thank you, guys. Oh my gosh. I can't even begin to express.
And for a brief afternoon, Shorey has most of his community all in one place.
Hail, the gang's all here.